This lecture is over the cancer medicine or oncology chapter in your medical terminology textbook. Starting with the introduction of the chapter, it says cancer is a disease caused by abnormal and excessive growth of cells in the body. It may arise in any tissue and appear at any time in life, although cancer occurs most frequently in older people. Cancer cells accumulate as growths called malignant tumors that compress, invade, and ultimately destroy the surrounding normal tissue. In addition to their local growth, cancerous cells can spread throughout the body by way of their bloodstream or our lymphatic vessels. In some patients, the spread of the cancers from their site of origin to the distant organs occurs early in the course of tumor growth and ultimately will result in death. Although more than 1/2 of all patients who develop cancer are cured of their disease, about 550,000 people die each year of cancer. Lung cancers, followed by breast, colorectal cancers are the most common causes of cancer deaths for women, and lung, colorectal, and prostate cancers are the leading causes of death due to cancer in men. So if we look at characteristics of tumors right away, really we want to know, is it benign versus malignant, and what's the difference between those two? Malignant is capable, it says, of invasion and spreading to surrounding distant sites. Okay, it's capable. It can go and travel. Benign is non-invasive or not spreading to other sites. Okay, so read through those number 1, 2, 3, and 4 and the difference between all of those. Really in number 4 there are bold terms, metastasize and metastasis. Metastasize is when it has spread. A metastasis is a secondary site, okay, of the cancer. And those two terms are very good for you to know. If you turn to the next page, they talk about what causes, how does cancer develop, what causes cancer. You know, what is clear is that malignant transformation results from damage to the genetic material or our DNA, okay? And our DNA does two basic things. Number one, it says it controls the production of new cells or cell division, and number two, it controls the production of new proteins within that cell. So if our DNA gets altered or transformed, okay, that's when we start to have issues, and they really talk about that on the next page, kind of straight across, where it says various kinds of damage to DNA results in malignancy. DNA damage can be caused by toxic chemicals, sunlight, tobacco, smoke, viruses, lots of things anymore, right? The specific damage usually involves changes in the cell's DNA codes, so the DNA changes. It creates abnormal genes with changes called mutations. The mutations then interfere with the accurate synthesis of the new proteins, and then is started to be passed on in cell division, okay? And it's just a snowball from there, right? They talk about heredity on the next page, doing genetic screenings. There's a lot of this oncology or cancer medicine chapter that you can read through. I would say the tables are much more informative than the actual reading. You can see the different types of connective tissue or epithelial tissue, and then the tumor that is involved with that. Go to pathologic descriptions and that blue heading. Gross description. So when you have a pathology report, okay, it's a document in your medical record. It's called Path Report or Pathology Report. Anytime we have a path report is because something was removed. Maybe you had your appendix taken out. Maybe you had your tonsils or adenoids removed. Maybe you had a mole removed. Anything at all, okay? You'll have a path report. Any kind of tissue that was removed will have a pathologic or a pathology report. Within that path report or that medical record, it's just a one-page document, you'll see gross and micro. A gross description is by my eye. This is what it looks like. It's not gross. It's gross, meaning by my eye, this is what I see. And these are all terms that can be used in the gross description. It's cystic, meaning it has lots of open sacs, right? It might be inflammatory, red, or swollen. It might be polypoid, so lots of polyps on there. And they talk about the different types, a sessile polyp or a pedunculated polyp. And then we see microscopic description. So then under the microscope, this is what I see. And these are terms that they would use in the microscopic description. So by my eye, the gross description shows that it looks like this, just looking at it. Microscopic then would be under the microscope, and then those terms, okay? Is it dysplastic? Is it papillary? Is it serous? Is it undifferentiated? Those are all terms that you would see in that pathology report anytime you had something removed. The grading and staging systems and how they do that is going to be important for you, I think, just to understand, just because we can help people then, you know, your knowledge is everybody else's knowledge. And then treatments, so different types of surgeries. You'll see excisional biopsy and incisional biopsy. Excisional, I have written in here, it's the entire thing. Okay, we excised or took off the entire thing. Incisional is just a piece. Okay, that's the difference between those two. We can do radiation therapy, and there's terms there for radiation therapy. Okay. And then chemotherapy, and there's terms and lots of reading for chemotherapy and the different types. Then they talk about immunotherapy, okay, which is becoming more and more common, I think, as well. They talk a little bit about clinical trials. Maybe you'll see clinical trials a little bit about once as you go through, and Mayo Clinic really does a great job with clinical trials and research. You can always research that, clinicaltrials.gov. I have students do that in another class. And then we get to actual terminology. So we have a lot of combining forms here. We have alveolo, caco, carcino, cautero, chemo, cryo, cysto, fibro, folliculo, fungi, medullo, mucoso, mute-A, mutageno, necro, neuro, onco, papillo, plazo, pleo, polypo, proto, radio, sarco, sero, watch the spelling with that RRH, zero. Then we have blastoma, genesis, oma, plasia, plasm, suppression, therapy, and then our prefixes here, ana, apo, brachy, epi, meta, neo, and tele. And a lot of these are going to be review for you. There's some that are specific for us here, but we get to clinical procedures. We have, when they talk about bone marrow or stem cell transplants, you see autologous and allo, okay, allogenic. Auto is self, and allo is other, okay, on where it's coming from, and the donor is what we're talking about there. And really, you can read through the rest of that chapter, and then the abbreviations are good there for you as well.